Thank you and good afternoon. I am Catherine Santoro, Director of Programming at the NIHCM Foundation. On behalf of NIHCM, thank you for joining us today for this important discussion. Climate change is the single biggest health threat facing humanity, and the World Health Organization expects approximately 250,000 more deaths per year globally from causes related to climate change. Today, we will hear from a prestigious panel of experts to discuss the impact of climate change on health and solutions to improve health outcomes. Before we hear from them, I want to thank NIHCM's President and CEO, Nancy Chalkley, and the NIHCM team who helped to convene today's event. You can find full biographies for our speakers along with today's agenda and copies of their slides on our website. We also invite you to join the conversation today on Twitter using the hashtag #ClimateChangesHealth. I am now pleased to introduce our first speaker, Dr. John Balbus, the Interim Director of the new Office of Climate Change and Health Equity within the Office of the Assistant Secretary for Health. A physician and public health professional with over 25 years of experience working on the health implications of climate change, including roles in the federal government since 2009. We're so honored to have him with us today to share an update on the priorities of the new Office of Climate Change and Health Equity.
Great. Thank you so much, Catherine, and to the NIHCM team for holding this webinar and for the honor of being able to speak to all of you. It's really a delight to be able to share what's going on with our Office of Climate Change and Health Equity, and also to share this webinar with our wonderful panel. Can I have the first slide, please? So I've been asked to give a bit of an overview of the impacts of climate change on health, and I'm going to move that on to health systems as well, and think of it in terms of not just the people, but also the healthcare delivery systems that serve those people. I'm going to say a little bit and show actually some images to help convey why it's important to link health equity to climate change and what those linkages look like. And then lastly, I'll have the opportunity to describe our office a little bit and the role that we're trying to take in helping health systems prepare for climate change. Next slide, please. So this is a slide that I've borrowed from my colleague George Luber at the CDC that links up from that center ring the manifestations of climate change that we see physically, the rising temperatures, the increasing frequency and severity of weather extremes, the rising sea level, and the actual increase in carbon dioxide concentrations, which have their own impacts. And then the next ring is showing that there are many different ways that those primary changes in climate can impact our health. And I think as managers of health systems, as people who are caring for public health, the message here is that there are a lot of different things that we have to think about, and they operate on very different timescales. So some of the impacts of climate change are related to extremes and anomalies in weather, severe heat waves, extreme precipitation events that can lead to flooding, storms that stay over one area and lead to devastation from wind and flooding, and are really in the realm of emergency preparedness and disaster management. Whereas other kinds of manifestations of climate change, things like warmer winters than we used to have, earlier springs, changes in precipitation patterns on a seasonal basis, can change vector ecology or can change the productivity of agricultural systems and lead to much longer term kinds of changes in where we see certain kinds of vector-borne diseases. For example, the spread of Lyme disease northward up into Canada, or malaria and dengue climbing the slopes of the Himalayas because of warming temperatures there. And then lastly, there are a lot of impacts that are complex and societal in nature. And some of these are relate to the mental health impacts that populations experience, especially populations tied to the land, like Native Americans and First Nation folks in this hemisphere, who are witnessing, massive changes in their natural environments that change the way that they live and really have massive impacts on where they can live and their entire cultural well-being, all the way through to some of the things that we're seeing in different parts of the world, whether it's from inundation of low-lying habitat or the drying up of water supplies and forcing migration, that have really profound and existential kinds of threats to living in certain places. So again, a wide range of health impacts. That outer ring is a subset of the diseases that are affected. So, from a clinical standpoint, there's a lot of different types of medicine, a lot of different practices, a lot of different types of facilities and systems that are impacted. Next slide, please. And what I want to convey is that while everybody is to some extent exposed to the changes in heat, to the extreme weather events, not everybody bears the same burden. And as we see with COVID, the people who are most at risk from climate change impacts are the people who are already saddled with health disparities and the burden of degradation of the basic social determinants of health, including both those that are related to economic opportunity, but also to the natural and built environments. People who are living in urban heat islands, people who are living in neighborhoods where the infrastructure has not been maintained as well as others. And we'll see pictures of what this really looks like. But the point is that the social determinants of health that COVID has certainly brought to the fore as being something that all health systems need to be thinking about pertains also to these exposure pathways and to who's put in harm's way and then who has the greatest risk from being exposed to heat, to wildfire smoke, to changes in allergens, to mold exposures from flooded homes. And again, as with COVID, people and populations who have higher rates of underlying chronic conditions, those could be hypertension, diabetes, obesity, anxiety, and depression, are the people who are going to be most at risk from these climate change related exposures. Next slide, please. So what does this mean for healthcare systems? This is just a quick crosscut of what we were just talking about. So there are specific populations that are at greater risk. This may be because of life stage, like the elderly or children. It may be because of racial and social discrimination and other factors and conditions, recent immigration that may lead to people having less resources, low income. It may be people who have are living with disabilities from either accidents or conditions of birth, et cetera. But for each of these populations that our healthcare systems are ensuring quality care for, there are specific health outcomes that the healthcare systems need to be aware of, trends that are increasing exposures over time, and need to be also aware that we're seeing multiple threats at the same time. So the way that we have seen the vaccination and testing tents and makeshift facilities, sometimes or temporary facilities for COVID, be threatened by heat waves and hurricanes and floods. We have to be thinking in a more flexible manner about the delivery of healthcare systems in a setting where there are both threats to the people and also threats to operations and to the continuity of operations. Next slide, please. And I just wanted to share a resource. This is a dynamic interactive resource on the web pages of the New England Journal of Medicine. But I just thought it's one of the few places where you can see a really well thought out framework for how climate change interacts not just with human health, which is the left box there at the top, but with health systems and healthcare delivery. And so you can see their impacts of climate change on everything from the costs of services, the costs of utilities, to the utilization of those delivery systems because of either heat stress or other factors that are causing people to seek care in emergency rooms, to the disruptions of the systems because of power outages or flooding, as well as to the stresses on public health in general. And then on the bottom there, you can see the different modalities of how health systems can make themselves more resilient in the face of climate change related health threats. Next slide, please. So just to go back and to show some of the ways in which health equity and climate change intersect. What I'm going to show now are a series of maps and pictures that are highlighting some of the recent research that is linking systemic and long-standing racial discrimination as manifest by the creation of maps by the Homeowners Loan Corporation and then the National Association of Real Estate Boards, in which neighborhoods were characterized according to their financial risk. And there was a 4-color code where green was the lowest risk, red was the highest risk, and any neighborhoods that were demarcated in red would be, in general, deprived of access to low interest loans and sometimes to finance some loans at all. And historically, those areas that of cities that were already segregated, that already had the highest proportion of African Americans, people of color, recent immigrants, were uniformly those neighborhoods where those people were found were in the red zone. And recent research is demonstrating that that has profound implications for the social determinants of health and health disparities. So this is just a side-by-side of one of those Homeowners Loan Corporation maps of the Fertile Crescent of New Orleans, dating back to the 1930s, next to the satellite image after the levees broke, just showing how the deprivation of financial resources is associated with the risk of inadequate infrastructure, in this case from flooding. Next slide, please. And this is just a sequence of several maps, and I'll go through them pretty quickly. This is one of the early maps from 1923, even before this was systematized into the nation's financial system, of a Richmond residential security map. And you can see that up to the northwest, to the left side, that's the green and blue zones, and off to the east and to the south, those are the red zones. Next slide, please. And this is a map showing that those zones are associated with the built environment. So this is a map of tree cover, and you can see on the left side there, the western side, their neighborhoods are more green. On the right, they've outlined those red line neighborhoods. And of course, now the center district doesn't have trees because that's all skyscrapers. But even to the east, you can see those eastern red line neighborhoods have much less green space and tree cover in this case compared to the west side. Next slide. This is also, of course, related to impervious surface. This is a map of impervious surface. On the left, you see that the zones look whiter. That's because they have less impervious surface. The darker gray on the right, more impervious surface, which means cement, which means trapping of heat and trapping of runoff and greater risk of flooding. Next slide, please. So if you have less tree cover, more concrete, you have higher summer temperatures, and that's what this map shows. The upper left western districts are blue, they're cooler. The red line districts are orange and tan, they are hotter. And so redlining that was put in place in 1923 is manifesting now in 2022 as urban heat islands and greater exposure to heat. And you can imagine greater exposure to transportation-related air pollution and other kinds of health threats as well. Next slide, please. So with that, let me pivot and discuss our office. Of course, our office was part of the mandates provided to the administration by the incoming presidency of Joseph Biden. There were 3 mandates given to the Department of Health and Human Services by Executive Order 14008, tackling the climate crisis at home and abroad. In addition to creating our office, we are also mandated to set up a new interagency working group to coordinate the federal agencies in protecting those most at risk from climate change and bringing a health equity lens to it, as well as a biennial healthcare system readiness advisory council of relevance to the health systems managers. Next slide, please. I'm sharing these quotes that were released at the launch of our office, which just took place a few months ago, August 31st, because they convey kind of the different dimensions of why I think this is a new day for climate change and health. Secretary Becerra talked about the moral imperative, and his quote is, "History will judge us for the actions we take to protect our world and our health from climate change." Admiral Levine, the HHS Assistant Secretary for Health, where the office is situated in her office, highlighted the health equity aspects of this and the the relationship between the lessons learned from COVID-19 and the inequities faced throughout our nation by COVID-19, and how these are the same groups struggling the most with the effects of climate change on our health. And then Gina McCarthy, former administrator of the EPA and now the Biden National Climate Advisor, had something very important, which is recognizing that America's world-class medical community, in other words, our health sector, and bringing the health sector into the fight against climate change is a very significant event. And with the next slide, we'll talk about what's going on in that space. So the picture in this slide is a picture of Admiral Levine at the Conference of Parties, the 26th Conference of Parties meeting in Glasgow, the big international UN-sponsored climate change meeting where the Paris climate change protocol was derived from the Kyoto Protocol, etc. This 26th COP, I think, will go down as one of the most important events in the history of climate change and health, in part because of the event that was captured here, which was the creation of a COP26 health program, in which for the first time, health ministries around the world came to the COP and made commitments to that are highlighted on the bottom there, to resilient health systems and low carbon health systems. This was the first time the US had an official delegation from the Department of Health and Human Services. And I do think that this elevation of the health sector in this space of global climate policy will be transformative in mobilizing people's opinions and actions to address the climate crisis. And so I won't read them, but you can see the language that we put to what we were doing as the United States for resilient health systems and low carbon health systems, in particular on the low carbon health systems, pulling together the federal health systems, which already had a mandate, from the Biden administration's targets to reduce, to account for greenhouse gases and set in place reduction plans, and also to partnership with the private health sector of the United States to share best practices and to bring the levers of the federal government to bear, the incentives, the financing, and ultimately, as Secretary Becerra made clear, the use of regulatory authorities, if needed and as needed in the future, to harmonize the health sector of the United States in these goals. And we divide our work into those three priorities that you see there. The first being protecting the most vulnerable from the health impacts. The second, recognizing what we've been discussing in terms of social determinants of health and the power of climate actions to address the transportation infrastructure, the green space in our neighborhoods, and so to work with those sectors to address quality of life, social determinants of health, and address some of those root causes of health disparities to make people more resilient. And then the third priority area, the health sector resilience. Next slide, please. And to codify that federal health system decarbonization, after the COP in early December, a new executive order with this title, Catalyzing America's Clean Energy Economy Through Federal Sustainability, set very specific targets for buildings, for fleets, for our energy supplies, for the federal health system, for the federal government, which includes the federal health systems of the Department of Defense, of the Veterans Administration, and the Indian Health Service, the community health centers of HRSA, the clinical centers of NIH, et cetera, all need to comply with this executive order. And so this is the federal government really walking the walk as we try to move the nation towards these decarbonization goals. Next slide, please. I will go quickly through these, but just some of the details in terms of the steps that we're taking in our early life, just a few months old. On our priority one, we are working with items that are actually part of the Justice 40 agenda, like efforts to make the low-income household energy assistance program and also some of the Medicaid flexibility more available to people to be able to address heat stress and be able to help low-income populations with energy costs, with purchase of air conditioning units, is for people who are most at risk. And we're also working as an office to convene the power of all the agencies across the federal family to address extreme heat. We've stood up a new working group there, and then we have that interagency working group on vulnerable populations more broadly that we've been mandated to create. Next slide, please. In terms of the actions to reduce health disparities, we're engaged in a lot of conversations with CMS, with HRSA, with other parts of HHS about ways that the current efforts to really start to identify deficiencies in the social determinants of health. Deficiencies in the social determinants of health and their role in health disparities through things like Z codes, through bringing them into the role of health systems to address the upstream social determinants, to make sure that those social determinants associated with climate change, with built environments, with housing, and energy security, as well as food security, can start to get incorporated. And then ultimately to help build technical capacity to look at the health implications of infrastructure projects working across those sectors and those agencies dealing with transportation, housing, et cetera. Next slide, please. And then in the area of health sector resilience and decarbonization, our COP26 commitments were really the big move so far. And then, as mentioned, we're working with our federal health system partners to identify those early steps, the key levers we can take to move all of the health systems of the federal government, and then bringing our federal partners together with the private health sector, especially through a National Academy of Medicine initiative that's going on, to identify the best practices and try to harmonize practices with the private health sector as well. Next slide, please. And as a piece of this, we are starting to work with our colleagues at CMS on gaining, walking down that path that it takes to get change in the policies, practices, support, and reimbursement policies of CMS, starting with this request for information. So this is a quote from a notice of proposed rulemaking. I think it's closing tomorrow. So if you have not yet seen it and had an opportunity to weigh in, please do. But we have language in there saying that the HHS wants to explore how exchanges in their constituent organizations can more fully prepare for the harmful impacts of climate change on their enrollees. And there's a lot of specifics behind that. Next slide, please. And next slide. So in summing up, I've listed some of the possible policy areas for exploration with the NIHCM, with those of you who are listening in. There's areas that we can shore up the resilience of health systems and communities. There's many different entities across the federal government that work on regional networks of hospitals of public health systems for preparedness. There's the preparedness of health systems and the policies through the emergency preparedness rule. We're looking at all of those things to make sure that there aren't gaps that people are falling through. We're looking at the flexibilities and innovation programs for supports to vulnerable beneficiaries, for housing, for energy security, looking at climate sensitive indicators into the measurement updates. We started with that RFI, and then looking in ways that we can not just say, well, these are the things you need to do, but to actually make it easy to do them by finding the financing and resources that we can, especially for those hospitals already strapped, especially for those systems caring for the most vulnerable, which tend to have the thinnest margins to start with, and also to find ways to give that technical assistance to make it easier for health systems to look at some of the decarbonization and resilience steps. On the decarbonization side, we're looking at evidence-based actions. Scopes 1 and 2 are what the hospitals have the most control over, 1 being the direct emissions of greenhouse gases, 2 being those associated with energy supplies. It's Scope 3 that's the bulk. Scope 3 are those associated with supply chains, and we're working very hard in a number of different ways to identify ways to bring our suppliers into the path of decarbonization and resilience as well, many corporations, many leaders in that sector are already walking down that path very far. We're looking to come up with easy ways to do the greenhouse gas accounting and to be able to publicly share that through tracking tools, to increase the technical assistance, and looking at those ways that we can work on the financial incentives, again, to remove as many barriers as we can to the progress that we know we have to take to make the health sector one of the partners in addressing the climate crisis. Next slide, please. So with that, I'll close. I look forward to the discussion we're going to have. I especially look forward to the next couple of presentations, bringing you know, kind of the real world perspective and making all this real. Please do visit us online at our website. We are going to be building that out over the coming months. We will and be sure to sign up for our listserv there, because that'll be our primary way of communicating what's going on, sending updates, alerts, and helping to build the resources for the whole community. Thank you very much, and I'll close there.
Thank you, Dr. Balbus, for your leadership on this issue. We look forward to continuing to hear about your work and exploring partnerships with the leaders on this webinar today. Next, we will hear from Heather McTeer Toney, Vice President of Community Engagement at the Environmental Defense Fund. In 2014, she was appointed by President Barack Obama as Regional Administrator for the Environmental Protection Agency's Southeast region. Known for her energetic and genuine commitment to people, her work has made her a national figure in the area of public service, environmental justice, and community engagement, and we're so honored to have her with us today. Heather?
Hello, and thanks so much. And thanks to all of you all for joining us. Today, I'm coming to you from the land of the Chickasaw and Choctaw people in what we know as the state of Mississippi, Oxford, Mississippi. This is my home, and I'm very glad to be sharing with you today. We'll move to the next slide. No slide, actually. I'm not going to use slides. So let's turn the slides off for a moment, because we want to have a conversation and talk through what are some of the elements to actually implementing the things that John just talked about. It's important that we know the what needs to be done, but more attuned to what I'm working on is the how do we do it? How do we practically apply and encourage communities to embrace and be empowered to take control of what their public health will be. And so there are a few elements that I want to walk through with you, and I look forward to the conversation about how do we actually get these solutions really embedded into communities such that we can see strong climate actions take place and that there is true equitable solutions that are available to all of us. When we think about the elements of equity and the elements that we need to apply in order to make climate solutions really stick in our communities, there are 4 elements that I want to share with you, and I've tried to make this easy so that they're all E's and we can all remember them and repeat them, quite frankly, amongst one another and really share. The first one is dealing with ethics in and of itself. Ethics and remembering and understanding that coming to this place, we have to, in a number of ways, share power and really dig into how we are showing up as public health officials, as government officials, but also the importance of the health impacts that people experience each and every day as a result of climate change. I love the title of this series, Climate Change is Health, because climate change really is a driver to how we are adapting, how we are experiencing, and how we're becoming more resilient each and every day. We see it in and through our public health means in communities all around the country. And so understanding the ethics of showing up, how we show up, is an important element to ensuring that we are implementing these factors each and every day in the same way. We have to show up transparently, authentically, and understanding the diverse communities which really have to that we have to focus on, because they are the first hit, as well as the ones that are recovering quite often from the climate impacts as they're increasing each and every single year. So ethics is number 1, keeping that at the forefront of how we go into these communities. The second one is experience. And this is so important. It is respecting the lived experience of community members. It's also the place that we see a lot of intersections. And when we are talking about public health, climate change, and how we go into these communities. There are a few things that came from David's presentation I really want to bring into light with respect to how we practically apply these. One is the history of communities and what we have to overcome in terms of our own experience in these spaces, the presence that local, federal, and state governments have played into how we got here in the first place. So one of the slides that was shared was redlining maps that came as a result of discriminatory redlining practices in the United States. And I'm so excited that that was one of the slides that was used because it respects and understands the intersection of housing, intersection of education, of permitting laws, of pollution, and how they came to be in these communities. And if we ignore that past history, that past lived experience, we take away from people who are living the experience today what they've had to go through just to get to where they are right now. So when you go to the doctor, you usually give a medical history of your family. Your doctor asks you to fill out a form that says whether or not you have a family history of asthma, health, chronic health diseases, cancer. They ask you if you had any surgeries. When you think of lived experience and it comes to climate change and public health, think of what is that medical history or that experience history from public health perspective for that particular community as we're going in and talking about solutions. Does that community have a history, a public health history that is disparate and different from other areas? Because understanding that history makes it so that we are deeply seeding really the solution that people want, they need, and that they're trying to recover from. We have seen through the experience of COVID that public health impacts and climate change impacts hit communities differently. And so a community that has been on the forefront of climate change, that is a low income community, oftentimes communities of color, oftentimes communities that have been underserved, underutilized, are the first ones to not only experience climate change in terms of being on the front line, but have the least resources. And they have had those historically. So understanding that lived experience can make a difference in terms of how and when we're able to really implement climate policy and pollution, climate policies and regulations that will stick and that communities can move forward. The next place is expectations. There's a saying, communities move at the speed of trust. The rest of the world tries to move at the speed of light, environmental movements, speed of light, but communities really move at the speed of trust. And that is so true. We all understand and know that climate change really is an existential crisis that is impacting global populations in ways that we cannot even imagine. And we're living it each and every single day. At the same time, when we rush these solutions, it often comes at the sacrifice and the detriment of those who are hardest hit, who are first hit, and are more likely to suffer extraordinary traumatic responses as a result. And so sometimes moving slower is moving faster. And we have to understand and really think through how we're coming into communities and what expectations are with respect to our timing and the community's timing of what they want to receive, how they're looking to receive it, and really how we are deeply intersecting climate solutions that, again, empower communities, engage them, and that they can carry on. The last fourth area is economics, and I want to spend a little time here. Because all too often we think about environmental justice and climate change in communities of color and those who are hardest hit in terms of a victimization. People need to and are recovering from environmental injustices that have plagued our communities for so long. But let's think about the opportunity. Climate change, green technology, clean energy jobs is putting us in a position to really transform wealth and health in communities all across the country. And this is a really special moment. I've spent time, I live in the Southeast, but I've spent a lot of time in and around communities that are often considered environmental justice. And one thing that I hear more often than not is, where's the conversation about what the future is going to be? So many people come to communities and say, we want to help reduce pollution. We want to help improve the disparate health impacts that are experienced by these communities. But what are my kids going to do in the next 15 years? What kind of jobs can we link to this recovery that also provide a regeneration for these communities? Thinking about the innovative ways that through health and climate, we can create not just salary jobs, but really truly, not just hourly jobs, but really truly sort of salary, long-term benefits in the health sector that create opportunities, that we're expanding and improving the health and well-being for a community, as well as reducing the disparate health impacts. All of these things intersect. We cannot have one without the other. So as we are talking about and thinking through an amazing set of policies that we now have an opportunity to employ, we know what to do. The how to do it has to come in line with it. President Biden's administration has put forth an all-of-government approach. They have really been at the forefront of talking about environmental justice in a way that we have not really seen. But the all-of-government approach cannot exist by itself. There has to be an all-of-community approach, which includes local leaders, public health care leaders, academia, philanthropy, faith-based community. There has to be an all-of-community approach that helps the policy development to be implemented and really embraced and carried forward, so that we're building one upon the other and really getting to efficient climate change solutions that are helpful and healthful for us all. That's why climate changing health is such an impactful way to say that we have this opportunity right now to dig into the how and accompanying it with the what we need to do. Let's go back through those again, and I look forward to the conversation. Thinking through the ethics, making sure that we're coming into communities in a way that is respectful, that understands the importance of sharing this power, where we've had in some spaces majority power that really needs to be shared with communities so that they can implement the policy in the way that they know best in their own communities. The lived experience and intersections of public health, education, climate change, violence, the number of different ways that there are health indicators as well as opportunities to understand the intersections and the experience of the communities such that they can really employ climate solutions. The expectations, which is the timing and how communities move at a speed of trust. Ethics helps us build that trust, but we have to move in a way that sometimes slower means faster, but it gets us there at the end point. And then finally, the economics, ensuring that we're not just talking to communities about how to improve their health, because that mother who has 3 kids and 2 of them have asthma, she still has to go to work. She still has to put food on the table, and her timing might be different than ours when we talk about what emissions are and how they're impacting her family. We have to think through the timing and make sure that it's suitable and achievable for all of us. And those economics, that is critical. Those are the opportunities that are wide open for all of us to jump into by putting the policy together with how we do it and how we enter these spaces. We'll go to the next slide. This is my information, contact information. I'm really looking forward to digging into this and getting some really good questions about the how, the practical nature of putting these into place. It's one of the things that I'm excited about us doing at the Environmental Defense Fund. I'm a former mayor. I come from the federal government. So this is a happy space for me to see us actually implementing these climate policies that have taken so long for us to really be in a position to employ. I look forward to the conversation.
Thank you so much, Heather. Next, we will hear from Dr. Lindsay Butler, an environmental epidemiologist, science communicator, and thought leader specializing in the intersection of climate change and human health. She serves as the Director of Climate and Health Resilience at Blue Cross Blue Shield of Massachusetts, and we're so pleased she's with us today. Lindsay?
Thank you so much, Catherine. Thanks to NIHCM for having us today, and thanks so much to Dr. Balbus and Heather for what they've shared. I'm going to talk a little bit about how we are trying to address some of the challenges and opportunities that have been shared so far, and really look beyond corporate sustainability at how we as a health insurer are combating climate change and trying to advance health equity. Next slide, please. So we are really trying to take an integrated approach. We've heard about how the Biden administration is taking an all-of-government approach. At Blue Cross, we really want to take an all-of-organization approach to our environmental stewardship. So really trying to prevent sustainability from being sort of a siloed thing that exists in one part of our company, but really integrating environmental sustainability and climate and health resilience to the ethos of our organization across everything we do. And we see that as sort of having three elements. You know, this is an evolving strategy as we try to stand up to the climate and health crises that we're seeing. But right now we sort of see three key components to the work. One is our own responsibility, recognizing that this isn't about personal and individual blame and shame, like many fossil fuel contributors have tried to get us to believe, but it's really about organizational and institutional change to address the climate crisis. So first, recognizing our own environmental footprint, our own environmental responsibility, and having our own ducks in a row. And like Dr. Balbus said, walking the walk. The second is the work that we do to advance environmental justice and our health equity work through our corporate citizenship team. And the third is our role as a trusted communicator. Heather talked about the importance of moving a community at the speed of trust, and we recognize that the Cross and Shield Blue Cross as an organization is a trusted communicator of health information. So we want to step up and we want to share information about the intersection of climate and health and how addressing the climate crisis is going to lead to healthier environments and healthier individuals. Next slide, please. Next slide. So just to highlight our work in our corporate sustainability and really sort of getting our own ducks in a row, on the one side, you'll see that we have made significant progress in reducing our environmental footprint at Blue Cross. Since 2010, we've reduced our electricity usage by almost 60%. We've made significant waste reductions. We're very intentional about the packaging and products that we allow into our buildings. We've reduced our use of paper. We've really become paper-free across the majority of our organization. So we've made progress. We have a robust corporate sustainability program, but now we need to take that further. We're working on improving our greenhouse gas accounting practices to better account for our Scope 3 emissions, which, as we know, are difficult to account for, but could represent a large piece of our emissions, especially with many of our employees working at home. How does that impact our environmental footprint as an organization? We're working towards carbon neutrality and zero waste. We are also trying to develop a best-in-class environmental responsible procurement program. We've been a leader in supplier diversity for a long time, and we want to get our environmental sourcing up to that same standard. So, you know, when we think about individual consumer power, right, we've seen that individual consumer power is key to advancing environmental actions, like we saw with BPA when it sort of came out of market based on the call of the consumer. Organizations also have a lot of power with how they use their dollars and their spending. So when we procure goods, when we procure services, when we enter into business partnerships, Blue Cross expects those partners to be doing the best that they can for the environment as well. And we want to use that power, that spending power, to really catalyze change. The last part of this is helping our associates and employees bring sustainability home. We're all adapting to this new remote work environment, and many people will stay working from home. So how do we take the practices we've developed for inside our buildings and bring those home to our employees at home, so they're working in healthier environments, that they're composting at home, and we're incentivizing them and educating them to do so. Next slide, please. We've also expanded our sustainable development goals. So previously we've reported on zero hunger, good health and well-being, and responsible consumption and production. Next slide, please. Moving forward, we are going to go after 3 more sustainable development goals, including sustainable cities and communities, climate action, and reducing inequalities. So we are expanding our reporting and expanding the way we approach our UN Sustainable Development Goals. Next slide. The next thing I want to talk about is the work we're doing to advance environmental justice, which is a pillar of our health justice strategy, which is our approach to corporate citizenship at Blue Cross. Next slide. Sorry, trying to whiz through so that we have time for conversation. This slide just highlights what our corporate citizenship strategy is and the work that we are doing in communities in Massachusetts to help people lead a healthier life with more equitable access to environments, experiences, and education needed for good health. We see that as that work sort of falls into 3 categories for us. That's our work to advance food justice, environmental justice, and racial justice. And EJ is obviously a really important part of the work that we're doing for climate and health equity. Next slide. Here I just highlight 2 of the partners that we work with to advance our EJ work. You know, really when you do this work, it's so important to really let the community lead the way. They know what the burden of pollution is and they know the work that needs to be done. So we partner with 2 organizations. These are just 2 examples, Green Roots and Eastie Farms, who both do terrific work in the Chelsea and East Boston area of Massachusetts, which has a really, really difficult burden of air pollution, noise pollution. There are some manufacturing operations along the Chelsea River, and we support these organizations with our grant making, through financial support, through in-kind support, and through providing volunteers through our employee volunteering programs. Next slide. Next, I want to talk about sort of that trusted communicator component of this work. So step 3 in our work to advance climate and health resilience is to communicate, to educate, and to empower. And I just want to recognize here that I think what has been one critical flaw of the environmental movement or environmental support for climate action, whatever you want to sort of talk about our need to galvanize around this work, is I think oftentimes environmentalists, public health officials, we assume that those members of the community that we want to work with, we want to get folks to change their behaviors, to prioritize these things, we assume that they understand. And so what we're doing is we're asking people to change without really telling them the why exactly. So we really see communicating, educating, and empowering people about the intersection of climate and health to be a really key part of this work that we can contribute to. Next slide. So I just want to highlight that there's a huge appetite, according to the Yale program on climate change communication, when asked if folks are interested in more information about climate change and wanting to see more reports in the news on climate change, a nationally representative sample from the US, 74% of people said they were interested in hearing more. Next slide. And up to 78% of people said they wanted to hear more about the impacts of global warming in their local community. And as Dr. Balbus said, many of the health impacts of climate change are highly localized. So it's interesting to know that 78% of people want to know more about that. Next slide. Here's an example of some of the ways that climate is impacting health that we think that our members, our providers, our associates should know about and maybe haven't had the opportunity to be exposed to this information. So for example, recent research on the health impacts of heat stress on children have found that in extreme heat, there's an increase in ear infections, in ER utilization for heat-related illnesses, in gastroenteritis and other adverse outcomes in children. We know there's a robust literature that heat stress is leading to higher rates of preterm birth, low birth weight, and stillbirth in the United States. And we know that there's many ways that climate change impacts air quality. And this just might not be information that people have been privy to. And as a health communicator, We want to help people learn about those things in a very accessible and easy way. Next slide. Dr. Balbus talks about the threat to our health infrastructure. You know, we have a lot of providers we work with. We have a robust network. Are they all aware of the ways in which climate change is a threat to our healthcare infrastructure? And what is our role in helping them to understand? Next slide. So how do we do that work to communicate and empower? We want to provide opportunities for our associates to learn about climate and environmental issues. We want to educate people about the ways in which the environment and health are connected, and really making it clear that the climate crisis is a health crisis. We want to support and incentivize action among our providers, among our members, among the communities we serve. And we want to work in partnership with municipal leaders and lawmakers to advance healthier environments for healthier people in the communities that we serve. At Blue Cross, about 80% of the municipalities in Massachusetts get some Blue Cross coverage from us, and some of them have robust climate action plans and are really ambitious, and some of them really haven't thought about their emissions or their climate change adaptation at all. So how can we support those varying degrees of climate planning in our municipalities? Next slide. I'm just going to jump through here in the interest of time. Next slide. Next slide. And next slide, sorry. I just want to close with this one quote from John Holdren, who was the climate advisor to President Obama, and said this back in 2007. We basically have three choices: mitigation, as we know that's reducing our emissions; adaptation, like increasing a wall to prevent from sea level rise; and suffering. We're going to do some of each. The question is, what is the mix going to be? The more mitigation we do, the less adaptation will be required and the less suffering there will be. Next slide. I'm happy to talk more about this with any healthcare organizations, any other insurers. I think, you know, it's very clear that we have an imperative as health organizations to really act on these issues. You can always contact me via email or on Twitter at Dr. Lindsay Butler.
Thank you, Lindsay. I'll ask all of our panelists to join us back on camera for our Q&A session. I'm going to start with a question for the full panel, but I'll throw it to Heather first. Can you share any thoughts on boosting resilience, specifically in rural health systems, which face the dual challenges of treating higher risk populations as well as financial challenges?
Yes, thanks, Catherine. I love this because it gives us an opportunity to leverage. Right now, the Biden administration has been successful in passing bipartisan infrastructure funding. So that means communities all around the country, particularly communities that are eligible for rural development dollars, will have funding to help think through very creative ways. So rural health associations, hospitals should partner with their local municipal leaders, county leaders, to see how they can leverage infrastructure dollars to improve the infrastructure of those hospital systems, around those hospital systems, and also partner with businesses in the area. There are a couple of great examples of that. South Carolina Regenesis Project is one. Blanking on a couple others, but there are a lot of them out there. I think that's a great place to start.
Great.
If I could just add, Catherine, one thing that we saw in Texas with some of the really severe storms was that community health centers with solar actually were still able to provide healthcare throughout the storms when some others had total collapse of their grid and infrastructure. Harvard is doing some excellent work around the resilience of healthcare infrastructure, Harvard Sea Change. So I'd recommend taking a look at some of the work they're doing.
Great, thank you. We had a few questions come in about clinical education, and we found there's a gap in clinical education of medical professionals of the actual health impacts of climate change, especially as it relates to air pollution and how to express that to patients. as well as the fact that US physicians have a lack of familiarity with the northern migration of tropical diseases and their health effects. And for John, or for any of the panelists, but John, you could start. Is there any part of clinical education that's a part of what you're working on? And is there any other work that you could share with our audience?
Sure. It is an important point. One of the things that I've felt, having worked on education, been in academic centers, been speaking with health professionals about climate change and health for over 25 years, is people need to know what they can do, and they need to know why they need to know it. And physicians and healthcare and nurses and healthcare professionals, more so than anybody else, because the curriculum is jammed, the educational needs are huge. So, my first answer to that question is yes. I mean, there's a lot of stuff going on, and we're supporting it, and we will continue to support it. And I think that the undergraduate years for most of the health professions are the best time, starting early. I think that kind of the beginning and the end. So when you have a little more space in the curriculum at the beginning, and then also in the continuing education, I think there's a lot that can be done in terms of maintenance of practice and projects going on in clinical spaces that relate to sustainability and resilience that can aid the growth of awareness and understanding in the health professions. But I think the more that we can tie this to clinical practice and what people are actually doing, so that it's there is an advocacy role, but I think there has to be also this pragmatic, why do I need to know this in order to make, be more effective and have higher quality delivery of care. But where I'm heading in this ramble is, I think when we are at the point where health systems have to get in alignment with the climate agenda, when health systems, when the people who are managing the floors have to be thinking about where their energy is coming from, where their food's coming from, where the food waste is going, when that becomes part of the DNA of the health system, that's when there will be transformative interest and understanding and educational opportunities, because people are going to have to learn how to do that. And in so doing, that will open up that space, I think.
Great. Lindsay or Heather, anything to add?
No, I agree. It gives us an opportunity to really, again, get to that economic piece as well, exploring those spaces where communities really want to see a forward focus on how they can engage in opportunities that provide education, that provide span and scope for how climate solutions are really going to be employed. And so it really is a great space to dig into a bit deeper on those opportunities.
I'll just echo what Dr. Balbus said about maybe the place for it is in the undergraduate education. I would argue that that's the case for no matter what an undergraduate is studying these days. No one should be leaving their undergraduate education without some knowledge of global warming and the way it impacts systems and the way it impacts human health. So I just wanted to echo that.
Great. Have time for one more question. We thank our audience for all the great questions, and we will be sharing them with the speakers. What do you think would be a starting point for a local organization that's just beginning to focus on how we can address climate change as a social determinant of health? And in terms of just one example of local health organizations, there were a few questions about helping community health centers or clinics who are on the front lines in communities right now.
I'll say real quickly, don't recreate the wheel. Both Dr. Butler and Dr. Balbus have provided a wealth of information in current existing research, as well as policy that is underway, that you should spend some time really reviewing, digging into, and seeing what's there that exists already, and how that overlaps what's happening in your current community. So doing a bit of listening within the community, but also taking advantage of these resources is a great first step.
Yeah, I think, also in line with the education question, I think one of the other main inroads for the change that we're looking to create and the health improvements we're looking for is, and Heather and Lindsay, you both touched on this, it's the social determinants of health. There are 7 categories of social determinants of health, but only 5 categories of Z codes right now. Natural and built environment are systematically not part of it, but when we put all 7 together, then we have that local solution space. If we can codify not just the educational, the transportation, the food security, domestic violence, homelessness, but also the quality of people's housing, the quality of you know, the green space and the natural environments that are so evidence just building, so important, both to climate resilience, but also just mental health and well-being. When we have that incorporated into how care is delivered and how upstream drivers of health are integrated into local healthcare, I think that's going to be very powerful. And so, to Heather's point, tapping into the resources that can give you that information. Sorry, Lynn.
Oh, I just wanted to say my initial thoughts are just on the acute side. I would say just awareness of heat stress. Awareness of heat stress when you are treating elderly patients, when you're treating children, when you're treating a pregnant woman, just awareness of that danger and communicating that danger to patients. And then on the longer term side, I would say you really can't reduce your emissions without knowing where they come from. So trying to do the best you can at accounting for your personal emissions or emissions as an organization.
Well, unfortunately, we are out of time. I want to thank our excellent panel of speakers for being with us and sharing your valuable insights and perspectives. We will be sharing a recording of the event and your slides. And thank you to our audience for joining in this discussion. Your feedback is important to us. Please take a moment to complete a brief survey that will open on your screen after this event, and you can also find out NIHCM's infographic on climate change and health on our website, and we look forward to continued conversations on this issue in the months and years ahead. So thank you all for joining us today.